Hi guys, welcome to Aorta Basics. My name's Steven. Let's get started. First things first, you're going to be using the curvilinear probe for this exam. The probe indicator is going to be pointed towards the patient's right, as is typical for the majority of exams. You're going to start just below the patient's xiphoid process, and you're going to be looking for the aorta over here on the patient's left, and you're also going to want to identify the IVC that's going to be on the patient's right. We're going to be using the spine to find out where the aorta is. So let's take a look at what that would actually look like in cross section. So all the way in the back here, we have the spine. In front of it, you have the aorta and the IVC. So on the ultrasound image, what we're going to see back here is this bright white line. That's the spine. And the black down here is because ultrasound doesn't travel well through the bone, so you just see shadowing back there. You use that to find the aorta, which is just right in front of it right here. Over here on this side, you see the IVC. Now, this is the best way to find the aorta if you're having trouble. Find the spine, look just in front of it, and you can almost always find the aorta. The whole point of doing this exam is to measure it, right? So the first few things that we're going to do is decide where to measure it. The first spot is going to be the celiac trunk. Then you're going to do the SMA, and the last one's going to be further down, and we'll talk about that in a little bit. So let's see what the celiac trunk looks like. You're going to identify that first by finding the aorta, which is the spine here, and then you see aorta right in front of it. Now, the celiac trunk, classically they call that the Siegel sign, and that's because you see these two vessels kind of coming off on both sides here that make a Siegel. And this is the celiac trunk that gives rise to both of them. So the vessel coming off this direction is the splenic artery, and the one coming off this direction is the hepatic artery. There's also a left gastric artery that comes off the celiac trunk, but we don't normally see that on ultrasound. So this is going to be the first location that you're going to take your measurement at. And the measurements that we're concerned about are really whether or not the aorta has an aneurysm. So less than 2 is normal, 2 to 3 is ectatic, and greater than 3 is aneurysmal. Now, we're not going to talk much about the pathology in this series, but just so you know, that's basically the whole basic point of doing an aortic scan. So just memorize those numbers for now. So the next spot we're going to measure is actually the SMA right here. And we're actually going to see the SMA in cross section rather than coming directly off. So what you see over here is the spine down here at the bottom, aorta here, and then you see SMA come into view right at the beginning of this clip right here, kind of as a cross-section vessel. There are a couple other vessels we want to identify in this picture, so I will bring up that image and give you guys a second to go over all of that. So pause the video here and try to identify everything in this clip, and we'll reconvene in a second to talk about the importance of a few of these. So just above the SMA, you have the splenic vein, and that runs over here into the venous confluence. So this is actually part of the portal system. So the portal vein comes in here, and the superior mesenteric vein comes in here. You can't really see either of those, but just know that that's basically that system. Over here, you have the IVC, and running across right here is the left renal vein, and that's all basically around the SMA right there. So the structure we're measuring is the aorta, but you should know all those structures just because there are some important relationships that will come up in the pathology series. The pancreas actually overlies, as you can see, the confluence in the splenic vein right here, so that's another important structure to know. The last spot you're going to be looking for is just above the bifurcation of the iliac vessels. So you just scan down, and just right above the umbilicus, you're going to find out where the aorta splits, and then you're going to pause it there, and you're going to take that measurement. So if you look at this clip, you see that the aorta actually splits into two, and so a spine here, aorta here, and you see it splitting into two in the beginning of that clip. You're going to go just right before it splits, take a measurement there, and then record the clip of it splitting so people know you're in the right location. You're pretty much done at this point with the exception of one thing. You want to just measure the entire aorta and long axis. Since we're only really measuring it at 3 points, you want to prove to someone that you didn't miss an aneurysm along the long axis of the aorta. So once you have it in a good cross-sectional view, you're going to slowly rotate the probe indicator towards the patient's head, and you should see an image at that point that looks like this. So this is spine back here, and then you see the aorta and long right above it. So as you can see, this is a normal caliber aorta, and there's no aneurysms that are visible here. That's basically it. The 3 points that you're going to be looking for, like we talked about: celiac trunk, SMA, the bifurcation, then get a shot in long. Go out there, enjoy scanning some aortas.